Joining me today is a seasoned biochemist with years of experience in diagnostics and pharmaceuticals. Ifeanyi Anyiam, you are welcome to my show.
Thank you very much.
Ifeanyi, it took a lot to bring you here. A biochemist.
Thank you.
I don't mean that in a degrading way. I'm like, wait.
I understand.
Your job is so demanding.
Well, sometimes it comes with its own pressures and challenges. But
what exactly do you do as a biochemist? I know the diagnostics part, you guys, laboratory,
yes,
tests.
Yeah. Okay, for pharmaceutical, my role is actually for detailing. That's what I do in pharmaceutical.
What's detailing?
Okay, detailing basically is talking to doctors about the new trends of certain drugs. Okay. The composition of those drugs, how they should be used, and what indications they are used for. So that they will be up to date about some of these drugs. Because sometimes doctors see these patients with the knowledge they have from the old. So if we bring in these drugs as a pharmaceutical company, we would like them to know the new trend, the benefits these drugs will have over the old ones.
Okay, so are you guys practically school doctors, or how do you guys do it?
Yes, there are research centers all over the world. They develop new trends for these drugs. So when they do that, they write all the details about what they found out, so that when the drugs are coming in ready, those details will follow them. So when they come, we are trained to know about these details because they've done the research, they've confirmed that these drugs will work, and they pass the knowledge to us. We now take that knowledge and the drug to these doctors and say, what you're practicing right now, we can enhance that, we can make it better with this knowledge that we have, and this is it. So when they have that, and they try it and it works, it becomes the new knowledge they're using to treat the patient.
Wow.
You understand?
Wow.
Because they don't have the time to go to start doing research and all that.
Fantastic. Okay, so this happens in Nigeria, yeah?
Well,
that these trainings, that you guys organize trainings for doctors, like you school doctors on new drugs, and
sometimes it's a collective training, like you bring doctors together in a hall and train them on certain things.
Okay.
Sometimes you have to go to their offices.
Okay.
Their doctor's room to train them.
No, sorry, I'm curious. My question would be, what I was asking, like this happens in Nigeria. Are there select hospitals you do this for?
No, you can do it for any doctor. Doctors have their own specialty. Like if the drug I'm trying to detail to you as a doctor is if you are, let me come from this end. If you are a urologist and I have a drug for urology, I will look for urologists in any hospital I go. Okay. So if I go to a hospital, doctors train for everything, but they also specialize.
Yeah, definitely.
So now, if I go to a hospital, I'll ask, okay, do you have a doctor here? They say yes. Where is he? I would like to speak with him. I'll introduce myself. When I find the doctor, I'll ask him his specialty. If he tells me he's in urology, fine. I'll talk to you on the drugs for urology.
Okay, so you train doctors and school them on certain medications that just enter into the country.
Yes.
You guys bring in those.
Okay, we bring the drugs in, and what we do is there are different ways you can train the doctors or detail to the doctors. Okay. Sometimes you can bring them together in the hall and tell them the new trends and tell them about the drugs and all, and the indications they can be used for, and the difference between the new drug and the old. And you can also go to their offices. Now, for specialties, doctors have specialties. Yeah. Now, if you're a urologist, if you have seen a urologist, you have to tell him about a urology drug and the benefits it has over what he has been using.
Okay, so what you do is you find out where the specialists work.
Yes. Right. Some of these hospitals don't.
Some hospitals don't have in-house specialists. I should know that. What hospitals do is hospitals have numbers. They have the contacts of people who specialize in different areas, in neurologists and anesthetics person and all of that. And when they have need for these people, or they'll give them a certain day to come in to see
well,
patients?
the
That's
truth,
what
the,
they
the
do. So
truth
how
is,
do you
we will know
circulate
that
this?
what we do is, that's why it's our job. What we do is every hospital is a potential place for us to meet whoever we want to talk to on that drug. So if we go there, we ask. There are hospitals that actually, you'll be surprised, there are hospitals that have in-house specialists on some of these areas.
Quite a few.
Yes, I agree.
Yeah.
Quite a few, but you may never know.
But I'm thinking, what drugs are these? Must be very high standard drugs.
Not
These must be quite expensive.
Not necessarily.
Are they afford? Are they? Can you find them in the general hospitals where most people, the average Nigerian, visits?
Well, for teaching hospitals, yes, you find them, but not all general hospitals will have some of these drugs.
Not general hospitals. So are these medicines really available to general hospitals?
Well, there are some general hospitals that have them, but most teaching hospitals have them, if not all. But general hospitals, very few of them.
Why? But there are doctors there.
Well, there are doctors there, but the specialists are more in the teaching hospitals.
Oh, okay.
You understand? So most times they see the patients, when they confirm these patients have these illnesses that they don't have specialists for, they now refer them to a tertiary hospital, which is the teaching hospital.
Oh, I see.
You understand? So, but most times they find out these illnesses from those general hospitals.
Okay.
Yes.
So what? You go, you train the doctors, you give them the medicine, or what? Is it on demand?
Well, it's on demand.
Oh wow.
We let them. We just keep them aware of.
So when a patient is ill, like has a certain illness, then what happens?
When they're ill, you contact us. That's the idea.
Wow.
You make them understand that okay,
they're not allowed to stock up the medicine.
They are allowed.
Okay.
Their pharmacies are allowed to stock it up, but some of them don't want to stock it up because some of these drugs are rare drugs or drugs for rare illnesses.
Oh, okay.
You understand? So it's not these illnesses are not found all the time, are not seen all the time.
Okay, I'm concerned. I'll tell you what. I'm concerned because so only in recent past there was the case of a lady who was she's an actress, so and the story really went on. It was on Instagram. Thankfully, she was documenting the progress of her. I think she had allergies. She was allergic to something that she had taken. She didn't know of. And she started swelling and all of that, and went to different hospitals, like 3 different hospitals, and they didn't have a single medication that she was looking for. She keep recording, the progress of the allergy and how she was swelling up, her mouth was swollen, and it was really a scary situation till she couldn't see. And then thankfully, when she put it on Instagram, people reposted, and people heard about it and came to her aid. So I'm wondering, medications are not allowed in our hospital. Is this country not a death trap?
No, it's not like they are not allowed in the hospital.
Are not found, easily.
Okay. Now, you can't blame them too for not having some of these medications because they are running a system as well. If they stock up these drugs and they don't have patients for them eventually, they expire on them. They lose money. Do you understand?
But things as simple as antihistamines, like these are allergies.
To you, it might look like it's simple. There are other drugs for allergies they can use. Perhaps she was not responding to those ones. Do you understand? So maybe those antihistamines were specific for her own conditions, and the hospital did not have them. Perhaps because they don't find patients with those illnesses all the time. So if they stock up these drugs and it expires on them, they lose. So sometimes what they do is they just have records of where they can get these drugs, so that when they find the patients, they just call them.
So that was even apply in an emergency situation like ours. Don't worry, we're coming back to that. We have to take a quick break, and when we come back, we'll hear more about the medications and emergencies, and we'll be listening to Ifeanyi Anyiam. Thank you. Stay tuned. Yeah, and we're still on talking with Ifeanyi Anyiam, who's educating us about medicine and drugs and the availability in Nigeria. Okay. So we're talking. All right. I'm concerned. Yeah. I don't know. You're living in a place where there are medical emergencies, okay, and you cannot find the medicine that is required to treat that emergency. You have to make a phone call, literally, to say you need so drugs, just because you might run at loss when you have those drugs and stock them up and they expire. I don't know, like, there must be a system to make this work. There must be a system to make sure that, regardless, even if this drug expires, but yes, we still have to have it in stock because human life is valuable, and we can't say we lose a human life rather than lose money. I don't know, there might be something is missing somewhere. What is?
Well, the truth is, some hospitals are improving. What they do now is they just stock up a few, maybe for just 1 or 2 patients.
Wow, these they're very expensive medications,
yes, they are. Yes, they are. They're quite
wow.
expensive. That's why they don't.
But sickness does not know money. I mean, the poor man can be sick. The same type of sickness can affect a poor man and a rich man. So.
Well, these people run a system, just like I said earlier. They have to pay their staff and all that. So if they are losing money from such things, and you should remember, medicine or pharmaceutical have different areas of drugs. Are you saying they should stock up all the areas when they don't need them? What I feel is there should be a system, a point of call that won't take a lot of time to reach the hospital.
That's airlift. That's by air.
No, that's not what I mean now. Like, what I mean is, in Nigeria here, there are actually hospitals that have these drugs. There are pharmacies that have these drugs.
Okay.
But not many of them.
Mm-hmm.
Do you understand what I'm saying? Mm-hmm. Now, if you affiliate with these people and say, okay, I might get to find patients with this illness. In an event where I find this patient, please, I would call you to bring this. How long will it take? So they work out all those things beforehand.
Okay. I'd like to say that Nigeria, whatever sector that we have in Nigeria, the entertainment sector, the health sector, whatever sector, is part of a bigger problem, which is Nigeria. Okay. So we can't exactly remove one sector and blame it entirely because, well, understandable. But I want to go on to ethical drugs. What is ethical drug?
Okay, ethical drugs are drugs you can't get over the counter. These are drugs that are controlled. They don't. You can't get these drugs without a doctor's prescription. They are controlled for a reason. Some of them, if abused, can kill the patient. So the doctor have to tell you, take this and take this quantity before you can take them. So they have to endorse something for you to be able to access these drugs. So the pharmacy, whatever pharmacy you're going to, you have to show them an evidence that a doctor actually said, I should take this before they can give you. And even when they see you with those prescriptions, they have to, what pharmacies do now, because a lot of them have gotten into trouble.
Okay.
Where people just forge prescriptions and all that. So
wow.
what they do now is they photocopy the prescription and keep it as an evidence.
Oh, okay.
To show that, okay, this person brought
that's
this.
Serious.
You understand?
But these drugs, how available are they to general pharmaceutical stores?
Well, not very many pharmaceutical companies deal in these drugs.
Only the very renowned ones.
Not renowned. Even some of the renowned ones don't deal in this area.
Wow.
Yes, they don't deal because it's a niche area. It's a very small area, but very, very serious. And it's growing actually. So some of them now are thinking of going into that area. Before now, cancer was not a very open case in Nigeria. Very few people had cancer. But now it's growing. You go to hospitals and you see them diagnosing people of cancer, different kinds of cancer.
Yeah.
You understand? So some of these big companies are now becoming interested in that area. Like, how do we tackle this? Do you understand? So even some of the companies that deal in these kinds of medicines are not very popular.
How available are those medications for cancer?
How available? Well, because not many people, many
right now, okay, good.
Deal in those areas.
Till now, yes, cancer drugs.
Yes, there are
wow.
Not many pharmaceutical companies.
We have many people who are being diagnosed.
Well, it is growing actually. The
numbers are skyrocketing.
The numbers are growing. Then another thing is the drugs are so expensive. that even the government now is trying to look into that area, or they're already looking into it. I know they're having partnership with Clinton Health Access Initiative. They want to work out something to help bring down the cost of these drugs, because you'll be surprised to find patients who you will tell the cost of these drugs and they will almost give up.
So safe to say that the poor man who has cancer has no hope in Nigeria.
Well, not so. Not so, because cancer is in stages. Cancer is in stages. It goes from stage 1, 2, 3, then 4. So at stage 1, some of the drugs they give them at stage 1 are not very expensive. So a lot of them are not expensive.
Okay.
So most people can afford at that stage.
Okay.
But going to higher stages, the cost goes up that way too. But right now, just like I said, government is trying to look into it so that whoever has cancer can actually afford it. They are partnering with very big multinational companies abroad.
Until they succeed, we are still not happy about the situation. It's still not a very happy situation.
Well, true, because they should have even done that long
okay, and I want to ask about your mom. I know your mom passed.
Yes. I
from cancer.
To breast cancer, precisely.
Wow.
So, well, for my mom, she had it. They diagnosed her, but she was going for chemo, but she kept away from her children.
Wow.
Yes, she kept away from her children. Me and my sister, she kept away from us. She said she didn't want to burden us with that
information.
Information at that time. She was going for chemo. So later on, they wrote higher drugs for her that were very expensive and all too. At some point, it was so bad that she had to call us and told us. By then, it had already gone to the higher stage. So I just told her, should have told me about this thing. It doesn't matter. So from there, we now took it up, and started fighting it. She had complications along the way. Even the doctor, I was even the only one the doctor could talk to, because at that time I was the only one that was knowledgeable about that area. Even when I told the doctor that, because the doctor had to ask me, he said, your mom had this and you allow it to get to this stage. I said, I didn't know. He said, nobody will believe you that you didn't know. I said, she never told me. He said, but nobody will believe you. I said, well, so at that point, it was just me. The doctor was telling the progress, because I was the one that understood. I had handled cancer patients. I have patients that had cancer. Doctor was managing how we want bringing the drugs and all that. So I understood what they go through and all that. So the doctor was able to pass certain information to me. At some point she had complications, and because we wanted to go for surgery.
Yeah.
But she had complications. She now started having edema. And the doctor said if we had gone for that surgery, we might lose her at that time.
Wow.
So they had to go palliative. Palliative was like giving her drugs that would manage the side effects, but not the tumor itself.
Ifeanyi, we'll come back to what you're saying.
All right.
We'll come back to what you're saying. Sorry about that. Okay, we'll have to take a quick break now, and then when we come back, we'll continue with Ifeanyi Anyiam. Please stick around. Welcome back to the show. Now we've been talking to Ifeanyi Anyiam. Ifeanyi, you were telling us the sorry story of how your mom passed from cancer. Yeah. So you said it progressed to a palliative stage?
No,
what's that?
I said she had complications at some point, so they had to go palliative. Palliative care is actually when you are giving the person drugs to take care of the side effects, because cancer comes with a lot of side effects, a whole lot of very bad side effects. So
cancer drugs comes with side effects, or cancer itself? Cancer drugs.
Side effects.
Wow.
And even cancer itself comes with side effects as well. So, but they had to start giving her drugs to take care of the side effects from the cancer, not just the side effect from the cancer, the pain and all. So they had to start giving her drugs to take care of that and not the tumor. But at some point she couldn't now even take the tumor. So I was the only one the doctor told that. Every other person still felt okay. The doctor was still on the tumor, but he made me understand that now I'm not on the tumor, I'm on palliative, because if we go into surgery, she might bleed to death, because the tumor had already spread to some of our vessels. So if you're going to go into that, they might cut our vessels and blood vessels and lead to death.
That's a lot of suffering.
So we had to go palliative, and while they were on that, when she passed.
I apologize for that.
It's okay.
And you were. It's been 2 years, right? Oh, time. It's well. That's all I can say. Yeah, wounds heal. Yeah.
Wounds that may not heal.
Right. But it's interesting that you're in the sector. Well, you said she didn't tell you in good time. What's the guarantee that if she had told you in good time, you could have done?
Well, cancer, if detected early, can be managed well. Some people even survive it when it's detected in time. That's why a lot of people are told to go for awareness. Even churches now, they don't just say, we'll cast a bite or we'll give you olive oil. No, a lot of them are becoming aware. So they even organize screening for their congregation and say, on this day we are screening for breast cancer. Everybody come out and people turn up. So the public is becoming aware of these things. They don't just say spiritual. No, it's not my portion. No, it's not my portion.
Right. Like anybody prays for it in the first place.
So people are aware now that they have to come out and detect it on time.
Right.
Because that's the best way to handle
early detection.
That's it, not the drugs.
Right.
The drugs are no guarantee.
Okay, so you know what you'll do? I need you to speak to someone who is passing through cancer. What do they do?
For somebody who cannot afford the drug, I would say you still go to see the doctors. Let them even detect that this is cancer first, because that's the first thing. Once they've said this is cancer, then there are organizations you can actually approach. Don't just stay home. You can approach the organizations that try to help people living with these illnesses. Approach these organizations, meet your churches, meet people, organizations that can help you raise funds. People have been helping, even Dangote have been helping people. Meet organizations to help you. Don't just stay and...
Do you have names of some of the organizations so that you can tell us?
Okay, Dangote helps a lot. I know Dangote helps a lot. There's this cancer foundation, I can't remember the name now, on Adenro Soya in Surulere.
Right.
There's a cancer foundation there. They also do a lot of awareness and they also help people to in their own way. Everybody have a limit to what they can do.
Then get online. Maybe if you Google, you just might find more information.
And even individuals that want to help people living with cancer. Then secondly is, a lot of people who go through cancer, what I would advise them, especially those even around them, because people always forget that, okay, somebody might be going through cancer. Because of that person, there's a lot of trauma for those living around that person. Because there's so much pain and depression around them at that time. I will tell them to be strong, because that's the best thing you can give to that person at that time. Because you showing depression and weakness weakens the person the more. You have to be the person's strength at that time. You have to do all you can to lift that person's spirit. Spend time more with that person than you usually do. Find out how you can help that person. Ease them of that pain. Take their mind off that thing, because a lot of them just feel once they are told they have cancer, it's a death sentence. So try to make them feel, okay, this is different.
And on that note, we have come to the end of this episode of Conversations with Maryjane. We'll see you same time next week. Bye-bye.